Dr. Pecora?
Doing well, thanks.
Wonderful. How are you, President? Sir President Keith?
Good afternoon, everybody. Glad
Good
to see you all. Thank you,
Yes.
thank you.
Glad to be seen.
Absolutely, in the number.
Absolutely. Absolutely. So we want to welcome all of you. We thought that it would be great to continue this discussion. This is a critically important discussion about data, and specifically child welfare data as it relates to African American children and family. So again, I want to thank, on behalf of BACW, I want to thank Dr. Pecora and Casey for their partnership and for putting together these very detailed reports. You guys should have seen the links to the documents that Dr. Pecora provided for us. So one of them is the data that he went over when we had our conference, and the other one is actually the 21st century research agenda for child welfare. And both of those documents are loaded with things for us to discuss and respond to. What I wanted to highlight as we get started today is, so we value Casey and the role that Casey plays in keeping the discussion moving, really being a standard bearer in terms of research, right? And in terms of movement around systems improvement, and wanting to clarify for the Black administrators in child welfare that our role is to advocate, to push, and to partner, because for 60 years, African Americans have been overrepresented in the system. And if we do not continue to push, advocate, and partner, we might be in the same situation in 60 more years. And that's not something that any of us want. So for us, it's more than just work. And I believe that about my colleagues at Casey too. I believe it for everybody. I don't think you would be here, right? If it was just about work. But for African Americans, for the Black administrators in child welfare, it's about family as well, right? And we have this personal connection. I think the other thing that I wanted to emphasize as we get started is that one of the things that we emphasize in our race equity strategy areas, the first thing we emphasize is that the importance of disaggregating the data and considering the context. And what we know is that there's loads of data, there's loads of interpretations, right? And so it's important for us to consider the context, what it means for where we are, and how we need to determine the action we have to take going forward. The other thing about disaggregating the data, in some places, that's not something that's even an option, right? Because you can't say race. And yet, what the data tell us is that there's been some progress, but there's not been enough because this issue persists. So I'm going to stop there and ask Keith if he would like to say anything. Oh, I see your hand, Keith. I didn't even realize your hand was raised. I'm just talking.
It just went up. No,
okay.
Thank you, Dr. Mitchell, and thank you all for individuals who are here today. You guys are just so awesome. I appreciate each of you. Thank you for your participation and moving this conversation forward. We had a great session yesterday as a follow-up with the lived experts, lived correspondents on this painting a canvas of triumph, and furthering the conversation about what conditions would need to be in place for there to be triumph, and just some great follow-up, which says that the work continues and needs to continue. The other thing, when we talk about, I'm gonna shift back to the data, Dr. Mitchell, as you talked about it depends on who's generating the data, who's interpreting and who's reading the data, and then the so what of the data. Oftentimes, the most important data point to me is a data point of voice, and that is the voice of those who are experiencing any kind of impact, change, connection to services or support, especially in the child welfare system and especially our African American children, families, and communities. And that's why we thought it not robbery. We thought it would be on purpose that standing shoulder to shoulder with us would be individuals who have those lived expertise. And that's why I'm so thankful also for Takoria and her willingness to partner in digging into the data with us, and to holding us accountable and to challenging us on, while things might have made some movement, not enough. And then how do we even articulate that movement of change? I always talk about that. Oftentimes we get on here and this is the choir, but it's oftentimes the other systems that have never heard this hymnal that needs to be a part of this congregation and around this movement. So I'm excited about today, and thank you all for being here.
Thank you, Keith. All right. Hey, Miss Jones, how you doing?
Well, I'm doing okay. It's a little warmer down here than I thought.
Where are you?
Be. I'm in Columbia, South Carolina.
South Carolina, okay.
Yes.
All right. Okay, wonderful. All right, well, as you all reviewed the documents that Dr. Pecora provided for us, were there questions or comments that stood out in terms of areas that you want to dig deeper into?
Hi, I'm Dr. Tia Gilchrist, and I'm with DCFS in LA County. I am the chief research analyst in the research section there, so I spend a lot of time thinking about data. And one of the things that came up in the session was the number of Black kids in care and how we've begun using the mixed race category. And being mixed myself, that's where it goes. So how is that affecting our numbers? And is that something we want to think about as a way to tease that out like we do with the Latina, Latinx? They can check white, but then we also ask like Hispanic origin or allow multiples. What are people's thoughts about that kind of data collection?
Thank you for that. And that is something that we've recognized over time, and especially, thinking about estimates of what's going to happen to our population going forward, there will be more and more mixed race individuals. And so what does that do for how data is captured on specific populations? And then also the question becomes, who is entering the data, and what information are they getting on the race and background of the individuals that they're inputting into the system, right? Peter, what are some national perspectives on the mixed race category as we're looking at disaggregated data and any trends?
It's increasing. So to Dr. Gilchrist's point, it's an area, I don't want to just say worry, but it's an area of concern in the sense that, what's going into that? What are the decision rules that I think you both alluded to? If for a study, one study at least we're involved in, we're pulling it out. We're not satisfied with it as just a lumping category. So if someone is African American, we're going to do some data that elevates that group. And a lot of times there's a trumping kind of rule. So if a person's Black and American Indian, they're categorized as Black, or they're Black and Latino, they're categorized as Black. And so sometimes that disaggregating it gives you that added subgroup look that I think Keith and other folks spoke to. That, you know, it's, and Tokoria said too, it's about, you got to break these numbers down and get at the story behind them. So that's why in the handout, we, our folks at Data Advocacy helped me, and they included a multiracial category in there. Fortunately, the multiracial group is trending in the same modestly positive way across all the ethnic groups, but I think we ought to be watching that for certain indicators. Maybe they won't. And I think to Dr. Gilchrist's point, what's lying behind those numbers? You know, which ethnic groups really are making up the multiracial category? And we better, I think, at Child Welfare start to unpack that a little bit. That's the, as much as I know about it, I wouldn't consider myself an expert in that area, but that's what I've been hearing from other people that are really concerned about. And how in one study with the University of Oklahoma, we're doing on ICWA principles, we're going to disaggregate that category. So I think it'd be great to raise that in the follow-up webinar that we have scheduled. Maybe raise that as an important point for people to really stay on top of this one and watch how it's going.
Peter, do you know, and I know that Dr. Alan Michael Graves from BACW is our representative on that research committee. And what I wonder is, has the committee discussed that, right? Discussed what the trends are and what that means for the work going forward, right? How because the data is only as good as what's put in, right? What is being done to influence accuracy and consistency, right? In terms of how people are categorized.
Yeah, I think this would be a great, I mean, Lisa Ford is on the actual steering committee for the National Research Agenda now. Alan stepped back along with Sharon McDaniels, but they were fantastic, you know, leading up to this. So now Lisa's in that role. And this, Kezia, your point reminds me that I'm wondering if BACW, it would be great to have a meeting between some folks from the National Research Agenda, BACW, and the Data Leaders Group. That's that core group. You know, maybe you guys have got somebody, you know, you've got somebody appointed to that. You may have somebody already on that represents LA. I don't know, but that's that group of data managers in public child welfare that meet like what, 3-4 times a year, generally virtually. But they're like the key experts that try to worry about various data elements. And I think putting that question in front of them, how are they educating staff to more accurately record the race and ethnicity of the children and the caregivers they're working with? Because I think we've all heard these stories about later they do a data audit and the ethnicity numbers are way off, or they totally miss the, you know, the American Indian kids and don't even go down that route to ask about possible tribal membership. But Kezia, well, you highlighted it, which was who's entering that data and how accurate is it? And I think that data leaders group, if you maybe a subset of the BACW, I think it would be a fantastic conversation with them. And we'd be happy to co-host that, you know, conversation with the data leaders group. We did appear before them and have a discussion with them about the National Research Agenda project writ large. And they're actually planning a couple of studies to try and address some of the 23 high priority gaps. So they seem to be a very responsive group when they're presented with new ideas or questions. And I think this would be a really important one to raise with them.
Right.
Hi, Peter and the rest of the participants. Now, AFGARs, what is the category? Has it changed with the AFGARs on a federal level as to what's determined by mixed race, or is it? Because that would be
I'm not a super expert on that, so I don't know if it is. I know the feds punted and delayed an improvement that would have better allowed public child welfare agencies to count American Indian children. I know they pushed that down the road. They just couldn't come to consensus or something, but I haven't heard of any major changes in AFCAR's definitions. But that could be something we could ask the data leaders group to maybe speak to with us.
Because I
because they
think
have
that's
made
where
some
it's going
changes
to
to
happen
AFCARs.
on the federal level if they're pushing
Yeah.
the jurisdictions to make it a requirement.
Yeah.
Right.
It's not an option versus when there's a lot of latitude. Some will do it, some won't.
Right. That's right. And Lisa, I'm sorry for neglecting to, Lisa Ford, I'm sorry for neglecting to acknowledge you as our representative on that research
No
team.
problem, no problem. It's fairly new, and I guess I can't replace Alan Michael and Dr. McDaniel, but I'm doing my best. I'm trying. Yes, it's fairly new.
I think you're doing a great job. Awesome. So Peter, I do have a follow-up question regarding your what you mentioned earlier about working on disaggregating even the multi-race data. What does that look like? What are the steps?
I've got to check in further with Claudette Grinnell Davis and some of the folks we're working with at the University of Oklahoma. But what it usually means is trying to unpack, to the extent they can, in the AFCARS and NCANS data, who's making up that multiracial group? What ethnicities are those children or caregivers affiliated with, really? So what combinations do we have in that? And then generally then they say, all right, then let's look at their outcomes and see if the outcomes vary. For example, do the Latino and American Indian children have sort of a different pattern of permanency and reunifications and termination of parental rights compared to the African American and American Indian, or the African American and Asian mixed children? The children have more than one ethnicity. What happens to them? Is what I'm hearing. And that in advance, we could actually pose that to the data leaders group and say, what are you guys learning? One, as any member, are any of your members doing that? And then what are you learning from when you unpack that? And in particular, have you had a chance to talk to your families, people with lived expertise, around what those data patterns mean? What's the story behind it? That would be a fair question to them. I think they'd be intrigued and challenged in a good way to have a conversation with BACW and the National Research Agenda team about that.
I love that. I have that down as an action step for us to pursue that, because it is a critical conversation. Keith?
Yeah, just a question. I'm gonna shift just a little bit. When you asked earlier about what were the things that you learned or things that kind of piqued your interest from last week, and really it's just one word. When we hear the word better, and when I hear the word, sometimes I get frightened by the word better, because in working with jurisdictions across the country, anytime that there's that better, it says I can stop doing what I'm doing. No. And we have arrived, or that, okay, we've accomplished everything that's happening. And then better is determined by who? I go back to my data point of voice. Have we had conversations with families? Have we had conversations? I go and can have these conversations with many jurisdictions. They can go to their data information system and they can pull out a report for me that says they had 1 million units of service. And some of you have heard me say this before. 1 million units of service. They will say that Miss Nina was a great lady. She came out here every week. She saw me. I got some services from her, etc. But when I talk to the lady that Miss Nina was servicing, she'll say, but yeah, Keith, my circumstances hadn't changed. I'm still unhoused. I am still underemployed. I still am scared to make any changes because my children are in the care, and one small mistake, I'm going to mess up and I won't get my children back. So the data says that we were out there and we did a lot of stuff. But when we talk to families, especially African-American families, their circumstances hadn't changed. So when I hear the word better, it always frightens me because it gives systems the authority to stop or slow down or to believe that they have arrived. So I just wanted to just kind of elevate that.
Great point, Keith. Ms. Jones, I'm so curious about your thoughts on this discussion so far. And then Nina, I see your hand, so I'll call on you later. After Ms. Jones.
There we go, unmute button. I am really still so appreciative of this conversation, and I still, in all honesty, have pretty much the same questions as I did the first time around. When community sees sets of data that appear to be at odds with each other, so we have this great, reduction of group care and reduction of Black children out of home, but then we have something conversely saying that the indicator that children exiting for any reason decreased or permanency decreased. So what is difficult again for the community to appreciate in these changes is that where do we go, right? Putting what we know. So we know in the community that group homes change. Group homes closed. There was a big thing about congregate care. And so where is that reflected? Where's the stuff that we know happened, right? We know that there was an epidemic in crack in the 80s, right? And prescription drugs nowadays and meth and whatnot. So looking at those kinds of data that the community knows well, we know that kinship care isn't that pushed and polished. It's getting there, but as it was changing in these places, what is happening also? So I do, I look at it and I'm still like, if we were to take this piece, take a line out of any of this data and hold it up to the community, what would we anticipate them to, how would we anticipate their response? What as researchers would we know to say, the numbers say this is happening. What do you say to these numbers? And how does this look like it's happening? What does this look like as it unfolds in your community? There's such a disconnect between the gathering and the exposing of we don't get statistics on us. I really wish we had rolling billboards, right? If this is in the neighborhood, this is what's going on, because we continue to inform the people who aren't doing as much about it, right? We continue to inform the agencies that are informing other agencies and informing other, this top-down structure. But when do we educate the people about the people, right? When do we educate the folks that it is the data is about? When do we give back to the community a picture of what this data is painting, right? How do we do that? I'm just not seeing that happen, and I'm not seeing much effort, because these reports are really high level. These reports are really big and they're important, yes, but when it comes down to it, what do we know? What can we say the community knows about itself? And at the end of the day, we are still in that, like, nothing that data is showing up in our community. We're not getting any more funding. We're not getting any more nonprofits. We're not getting any more concentrated services because of this data. So what is this data doing for the people that the data comes out of?
Thank you for that. Great insight, great questions. And I want to ask Ms. Nina and Dr. Gilchrist to pose their questions, and then I want to circle back to our response to Ms. Jones.
Oh, I'm okay with the response to Miss Jones, if, because I can defer, because I really your question, I think her comments just harken in my spirit more about how to connect the dots. The data is the foundation
Right.
of our baseline of information, but
Mhm.
connecting the dots to what I heard, and I don't know if that's what you're thinking, Miss Jones, around when we say there are children who are having so-called exits from foster care or congregate care, what does that really look like for the community as a whole? Meaning, are we talking about the children's outcomes, meaning that they really become, connected to family again? That's why their family finding and all that kind of stuff happens. Are they really getting back connected to their family? Are they getting some sort of adoptive family? Are they ending up in, unfortunately, prison or death, or homelessness? That type of, ultimately, it's a foundation of information, but it leads somewhere for this young person because they're not going to be under public child welfare for the rest of their life. So this is the foundation of information leading to hopefully a positive outcome where we can say the children aren't ending up, because when I was growing up, it's like this concept of people end up dead, unfortunately, or in prison. Like that there was this perception that there's this small group that end up in a productive adult life and the rest are lost, and we don't want anybody lost.
Right.
Nobody's lost. We
Right.
need everybody in the fold to evolve and become their best self because they have value and worth.
That's
So
right.
I know that this is like preaching to the choir that we all see the value and worth in every single child, every single family. But how do we connect that to understanding the impact and what Keith said about perspective, the perspective of the data from different people, different organizations, to the community and their perspective. And basically, I consider it the end users of the people,
That's right.
the people.
Right.
And it's not an easy task, but I think as long as we're having these kind of meaningful conversations and partnerships, that we have a chance to actually, and I feel hopeful, an opportunity to ultimately connect those dots in a meaningful way, that we can tease out exactly what's helpful. So
Thank
with that, I'll release the mic. Sorry.
Oh, no, thank you for that. I think that was excellent because you underscored much of what Ms. Jones said, right? The other thing that what you brought up reminded me of is one of our correspondents at the conference talked about this low percentage of foster care alumni who go to college, right? Versus the higher percentages of folks that don't achieve permanency and may experience homelessness and other issues, right? And so then that's where we get to, what happens after exit, right? So like you said, Nina, some of them do go to college. Unfortunately, it's not enough. And that's something that we need to push and emphasize. But back to Ms. Jones' point, where did they go? And back to your point, where did they go, right? Exit to where? And what does that mean for what we need to be doing in the child welfare space? Dr. Gilchrist?
You guys are exactly where I wanted to ask next. Thank you, Nina. That was the other note that I had from our session the other day about moving the kids to the judicial system. And I wanted to ask Decoria from the community's perspective. So we've closed these group homes. Where do they feel like our kids are going? Are we more kids unnecessarily in the juvenile system because we don't have a placement for them without the group homes? Or what does the community feel when we say, oh, look, we've got less kids in group homes, we've closed them down? Do they think that we're actually solving a problem there?
That's a great, I think that's a great question. And Ms. Jones, I do want you to respond, but, you know, from looking at some of the trends in Los Angeles and in the state, you know, as we moved from congregate care to the STRTP model, one of the things I knew when the STRTPs were implemented was that the kids who were there would be the hardest ones to place, right? That sounds like a no-brainer, but it's significant because they're hard to place for a reason, right? And so if the STRTP model says that in 6 months, we want to move you to a lower level of care, we want to, you know, try to move you to permanency. But what data is being tracked on the moves? Because what seems like is happening is kids are bouncing from STRTP to STRTP, and in between, they're going into temporary shelter care. So are we not really reducing the number of kids in congregate care, right? Or are we achieving what we set out to achieve with this STRTP model, right? Or is it really just this revolving door, right? And if that's the case, what do we take away from that, and how do we work differently? I didn't mean for everybody to get quiet. Peter, go ahead. I'm sorry. Go ahead, Ms. Jones.
I was just going to say, I really appreciate that conversation, and additionally, that idea of, you know, are we missing things that are working because we're not paying attention to the final points, the finer points of the data? You know, is fictive kin becoming a thing where young folks are finding somewhere to go and making it work? I just really wanted to appreciate that idea of, when we know all the parts, we have a clear understanding of what works and what doesn't. And we do ourselves such a disservice when we get to one set of information and say, okay, we know enough, or this is as far as it needs to go, when it really needs to get all the way down, past the data point, to the heartbeat, make that a commonality, right? Make that something that agencies do. They have this data, then they go find it in real life. They go show that this is what it looks like, because our communities are there. There's all these community opportunity mapping, and there's all these data points and dashboards that agencies are using now. Let's get into that data and really find what it looks like.
You
So
know,
it depends on what the perspective is. Okay, so, you know, if we're having a national conversation, then the national data is really valuable, right? And at times we're working with national legislators and we're trying to get them to invest more money in prevention services instead of dumping it into group homes. And we're trying to get, now the latest push is to get the feds to support economic and housing supports, because we know if we can help families with their basic income and employment and housing, they're less likely to be involved in child welfare. So part of it is we got to be careful with ourselves. We're not criticizing. If we're having a national conversation, we're going to use national data. If I'm working if I was working in Bayview, Wisconsin, where I started that community center, I'd be using community center level data. Okay, I would be using neighborhood level data. I wouldn't be using national data. So I think we got to cut ourselves some slacks here and say, hey, what's the focus? To Kokoria's point, if I'm working in a community, I'm going out and doing a speech for Minnesota in about a month. I'm going to use the latest data I've got for Minnesota. I'm not going to use national data, just as a comparison maybe, but I'm going to focus on Minnesota's data because to Corey's point, it's about your, now if I'm working in a particular city or county or neighborhood, so to Corey's point, we should be using that neighborhood's data maybe in relation to the county or state, but it's that neighborhood's data that is important. So, so there's that one point. Second point is, sometimes in our field, we don't like good news. We want to disbelieve good news. I'm sorry. Sometimes we are making benefit and we're making damn good progress. I mean, folks, a 47% reduction in the number of African-American children in foster care in the United States is a huge reduction, okay? Let's not deny that, minimize it. However, just because we're making good progress in one area, to Keith's point, that doesn't mean we need to let up, because if we let up, those numbers will go back, right? Racism is always present. If we don't fight that, fight worker attitudes, look at the structures, the financial incentives that come into play, those numbers will go back up. So part of me says we should look for and celebrate when we get good data, but to Keith's point, that doesn't mean you let up. And to Corey and other people's points, that doesn't mean there's other problems in the system that don't need to be changed, right? We still got too many kids getting reported in to these CPS hotlines. We still have, to the points that were raised in the seminar, right? Too many children aging out of care without a permanent place. We still have, and David Sanders talks about this. He's really worried about it. We've had a slowdown in the agencies be able to find forever homes, reunification or guardianship for African-American children. They're getting stuck, and American Indian children too. They're not moving to permanency as quickly as I think we all would like. So I always want to argue both sides. I want to find, if there is, where there's some good progress being made, so we don't let up on that. But I also want to dig into, well, where are things not so good, And so I think it makes for a more complex conversation because people want it to be all one or another, but that's not true. Your work, other advocates have somehow reduced the number of African-American kids sitting in a foster home or a group home by 47% since 2005. How the heck have we been doing that? And what can we do to make that, so there's 0 kids. The only kids who end up in out-of-home care are with an aunt or a grandmother or a tribal clan member, right? No stranger foster care. And even the number of kids going into care goes way down. I think those are, some of the goals we would all have for each other for this country. But so that's a couple of points on this. I think there are a lot of complexities here, but to Corey's point and Keith's point, it's like, well, what's the data look like locally? Like Tia, you're saying, hey, Keith's away because LA, there has been a big reduction in the use of group care. There's been a big reduction in sending kids out of state to some of those lousy places in group care. But then have we beefed up the relative treatment foster homes? Do we have enough adequate supply of treatment foster care to help keep those children in their neighborhoods? And I think that's where maybe some of the things the researchers and the advocates are saying, well, probably maybe not so good yet. So I like this, where the conversation's heading about, there are deeper questions here to get at. But I do want us to acknowledge where there is good news, at least at certain levels, we ought to celebrate that. And I tell you, if you went down to the local data in a bunch of communities, you would still find a huge reduction in the proportion of African-American children going into care. And they're not going into juvenile justice, and they're not going into prisons. They're staying home, or they're living with their grandmother or their aunt, because child welfare finally has got it through its head that kin care is a hell of a lot better than stranger care. And if you can keep a kid out of the child welfare system and informally place them with family, then that's all right. So anyways, I know there are all kinds of complexities with this, but I do think we're making some progress in some areas.
Agreed.
A
Thank
point
you.
of clarity, if I'm sorry, I'm just not sure if when they go to family, does that then not become a permanency thing? Like that whole idea that there's somewhere to go, but then the permanency numbers still don't look good. That's the conflict.
Did you
Corey, I
hear that
didn't quite
statement,
hear
Peter?
you. I didn't quite hear that. I mean, there is this notion of, I mean, here's right, Keith, you can always peel the layers. But, you know, what I worry about is when children are placed in relatives, but the relatives don't get some of the supports they need, the mental health supports, the tutoring supports, or the healthcare supports, because the kid's got asthma and they don't have an adequate insurance system coverage, you know? So I worry about that. What do we call that? Shadow foster care, or there's a term for that kind of kinship care where the kin parents are not being supported well enough. I think we worry about that for sure, if that's what you were getting at, Decoria.
Well, maybe, but more so if those kinship care arrangements are happening, why isn't it reflected in better permanency? Because
well,
those
we are. I mean, that's
numbers,
why we've got higher rates of permanency, because steadily in most counties and states, the number of children in kinship care has been climbing. I mean, some places in Florida for a while was 98% children got to a kin care. So people can do it. I think Sharon McDaniel's agency in Allegheny, I think they're up to over 40, 50% in that county, thanks to the work of her agency. It's not where it needs to be, I think, but it has been climbing, and that's what's allowing more children to not go into the more mainstream, you know, non-relative foster care system.
So Peter, I did have a follow-up question to your comment about neighborhood level data. What are some of the challenges to acquiring, reporting that, and then of course, to Coria's point, getting to the point where we can make that available to members of the community?
Yeah, that's one reason why, and Coria, we're hoping Coria's going to help us on disseminating it. That community opportunity map, we have that free tool. Now, it doesn't have child welfare data, but what it does sometimes is it pressures the local child welfare agency into producing that data, because we can go right down to a neighborhood with like unemployment, housing, you know, a number of indicators, education, achievement, et cetera. But it doesn't include the child welfare data, because that's what that child welfare agency should do. When we break it down, sometimes it really surprises the neighborhood residents and even the public child welfare agencies. I remember was down in one of the counties in Florida. They broke out the data and they showed what neighborhoods most of the children were coming from. And then they co-aligned it with public assistance receipt or non-receipt. They were eligible, but they weren't getting it. And the local manager there, veteran in child welfare, she broke down in tears. She cried. She said, I had never seen this data this way. It was so powerful for her. And she could see there are 3 or 4 blocks she has to do a much better job with in supporting those families. And that data never was really visible for her until it got broken down that way. Still remember the conversation was very powerful. So that, all politics is local. I think all data ought to be local too. Like Decoria said, you go down the street and see it on your billboard. How are we doing today around kids staying with their families? You know, how are we doing today in terms of number of kids in poverty, you know, et cetera. You know, we've been tracking fentanyl overdoses in King County by neighborhood. And anyway, so yeah, I think that's the challenge, is having the child welfare agencies have the time and a little bit of person power to break that data down right into the neighborhood level. And then you use the community opportunity map or some other geo mapping tool to then bring that data to the people who can make the difference around it, which is the local politicians and the residents.
Peter, as it relates to fentanyl, we talked a bit about previous kind of drug crises and the impact that they had on Black families and child welfare. What are researchers seeing about the impact of this fentanyl and other opioid crisis on African Americans specifically?
I'm really worried about it. I can just tell you from just an American Indian kind of perspective, our local Lummi tribe, which is the Tulalip tribe, which I've done work with over the years, they've had like 6 deaths in the last 2 weeks. They're in crisis. It's a fairly concentrated it's a very sort of 10 or so square mile area. It's reservation and right off reservation. This stuff is so deadly. In minute quantities, it's so deadly that I think a lot of people in various ethnic groups are very, very, very concerned about how rapidly this seems to be spreading and how deadly. It's not even kids ending up in care; they're ending up dead. They check into a hotel room and there's some residue on a counter somewhere. They put their hand in it or whatever, and they're dead. I mean, it's that kind of tragedy we're seeing. So I don't know. I haven't been tracking by ethnic group per se, but I'm just I know from in our central district in Seattle, there are a lot of concerns about that.
Thank you for that.
Yeah.
That insight. So we talked about, in terms of next steps, we talked about scheduling another session in partnership with Casey to talk to the research team about this issue of race categorization and the accuracy of that, how that is reported, and also this question about disaggregating multi-ethnic designations. So those are 2 issues that we have identified as wanting to follow up on in a session. Hopefully we can do it this year. We're getting into the holidays, right? But of course we want it to be planned well. So the other thing that comes up for me is this question about neighborhood level data and getting data to the community and getting their thoughts on it. What do you guys think about next steps on that? Should that be, it sounds like that's a separate session. What do you all think? Did someone raise their hand? No. Okay. I see head shaking. Like, that sounds good. Thank you. And Dr. Tia says, I don't think we are prepared for fentanyl at all. You're absolutely right. One of the moms from my daughter's track team, we could tell that family is struggling. They have an informal kinship kind of support, right? So we have an aunt that is very, very active, but last week heard that mom had overdosed. And we were just with her in Oregon for Junior Olympics, and just thinking about the impact that's going to have on that child, right? And so not only were we not prepared for it, right, but we're seeing and feeling it. It's closer and closer. So I think that is probably another area that we want to explore. Are there other questions or comments as we prepare to close? We've got 8 more minutes.
Dr. Pecor, I really, go ahead. I'll talk about it. You go ahead.
Go ahead, Ms. Jones.
I am really, I have always been an advocate of the community's opportunities map. That's what I was trying to say before, but the O wouldn't come out. It's just that I really wish there was I'd love to be involved with helping more organizations and agencies really understand how to use that tool. I mean, I know we've talked a lot about kinship care. And I'm wondering how the conversation of fictive care is coming into the space as that's becoming more and more of a recognized arrangement. I'm finding myself in the midst of a fictive kinship care situation, and so it's really dawned on me that how often this kind of thing takes place and how often it could take place to provide that buffer. So wanted to make that comment about the CLM and about fictive kinship care.
Right, you're right, Corey, and I think folks here in the room may know better than me, but that's where I heard that was one of the drivers of why guardianship and subsidized guardianship are just zooming. They're expecting that, right? I think guardianship and subsidized adoption are going to outpace, thankfully, maybe in some respects, payments that public child welfare agencies are making, outpace foster care because it's starting to grow. Because if you're a family friend, maybe you're not eligible for maybe some of the kinship care stuff, but if you get a guardianship order from a judge, then you can act as that child's, guardian and parent, sign off things. So I'm wondering, Corey, maybe that's one of the reasons why we're seeing such a steady increase in guardianship, maybe. I don't know. I have heard that though, that the numbers have been going up. But well worth exploring too, if folks wanted to have a follow-up on that. I did want to ask, we do have a webinar scheduled for, is it next week? And as a follow-up to the conference. And is there anything in particular that folks wanted to make sure was presented?
What's the date on that one, Peter? I don't remember.
Thank you. It's maybe Decoria knows too, but she's I know you're in a car. It's I thought, come on, Peter. I'm looking. Oh, geez, Peter, I should know this. You got it.
Lisa
I thought we signed it. I thought we said something. Oh, and the email was going to come out, and it was, follow-up was, October 5th at 2 p.m.
That's us. That's today.
Okay.
That's us. We're here. So we want to schedule. I'm like,
right.
wow.
It was
okay.
the smaller group of us. Okay. I thought it was going to be a big, large thing. So,
Yeah, it
anyways,
did go out to our network, and we certainly will be distributing the recording of this session. And we had another session yesterday. We want to distribute it to the network because what we hear from folks is that they just aren't able to log on, but they do want the information. So thank you for that. So Lisa Thorpe, you had a comment or question?
Yes, I just want to make sure on our follow-ups, you all hit a really key point about the community, making sure that the data that is collected is understandable. And I don't mean dummy it down, but in a way that they can be involved as well as aware. Yeah. And I think a lot of times when we do research and we do data collection, we forget about the fact that, and they don't want to come to the table because they feel like we'll never understand it when you put it in writing anyhow. So why even be a part of it? Why put our voice out there? So let's just continue with making sure the community, that the data is community friendly.
Nice. Okay. Thank you for that. Keith, you got our last comments, and you can actually close us out.
All right. Well, no, I want to thank everybody for attending. I think the conversation has been flowing and right on point, and it just spurs us to have to continue to have these conversations. And I'm just encouraging us to have them in many different places. There are many different people who have a responsibility for children, families, and communities, especially African-American children, families, and communities. I want to invite to the space educators. I want to invite to the space housing authorities. I want to invite to the space employers or the employment system. When we take a look at the schools, 70% of all referrals for children coming in foster care come from the school system. And are they part of these conversations? Are their heart space and mindsets changing, shifting based on the data? Has there been anybody to present that data to them in a way in which it would change and alter their perceptions and their assessments about those families that sit before them? Therefore, their reporting might be different. So looking at it and doing it in a different way. And then also, I want to have a conversation, Lisa, are you seeing that even with the data, is that propelling practitioners to do things in a different way? Many of these jurisdictions fund different providers all across this country for therapy and for all the behavioral health services. But if they are not aware or are able to synthesize the data and to interpret, is their practice changing? What is their services to children and to families and communities? So a lot of stuff to continue to have the conversation about. But as Dr. Mitchell indicated, this information has been recorded and will be available for review, not only by yourselves, but for others. And we are committed to have ongoing conversations, and we will put forth efforts to do so. So stay tuned.
Wonderful. Thank you all. And look for information on this recording, the recording from yesterday, and then future sessions. Okay. Thank you. Have a great afternoon.
Thank you. Take care.
Bye, everyone. Have a great afternoon.
Bye.